Bismillahirrahmanirrahim. My name is Dr. Samina Khurshid. I am Assistant Professor in Department of Obs and Gynae in Fatma Memorial Hospital. Today I am giving you the lecture about the contraception. This is the diagram this is my parent institution, and this is the institution where I am working nowadays. Now, what is the learning outcome of this lecture? What is contraception? Why contraception is needed? What is an ideal contraceptive method? And what are the different methods of contraception? What is contraception? Contraception means contra means against and septions means conception. Contraceptive method, the preventive method to help the women to avoid unwanted pregnancies, are called contraceptive methods. Why contraception is needed? That is to avoid the unwanted pregnancies, to regulate the interval between the pregnancies, and to avoid the STDs like AIDS. What is an ideal contraceptive method? The ideal contraceptive method should be safe, it should be effective, it should be acceptable for all the community people, it should be independent of the intercourse, it should be reversible, inexpensive, long-lasting, and require little or no need of supervision. What are the contraceptive methods that are available? These are reversible methods and irreversible methods. Reversible methods are also known as the spacing methods, and the terminal methods are also known as irreversible methods. Spacing methods include the barrier methods, IUDs, hormonal methods, and the emergency contraceptive methods. The terminal methods include the male sterilization and the female sterilization. Barrier methods includes the male condom, the female condom, diaphragm, and the spermicides. The male condom is the most commonly used method. This is the diagram that is showing the male condom. The female condom, this is the diagram that is showing the female condom. The diaphragms are available in the form of the cup. They are fixed on the cervix and they contain the spermicidal agents, and they kill the sperm as well as inhibit the transmission of the sperms from the vagina into the uterus. The spermicides are the surface active agents which attach themselves to the spermatozoa and kill them. Available in the various forms like foams, creams, suppositories, and the soluble gels. Now the second group that is included in the spacing methods includes the IUDs. These are available in the form of the copper teas, multi-loads, and the Mirena. These are the hormonal and the non-hormonal preparations. Copper tea, this is the diagram that is showing the copper tea. That is the plastic frame with a copper wire around the stem, and the surface area of the copper determines the lifespan and the efficacy of the device, and it can last for about up to 10 years. Multi-load mechanism of action is inflammatory reaction. That is, it creates the inflammatory reaction within the uterus that affect the sperm and the egg viability and hence the implantation. Now, what are the side effects of the copper tea? They can be expelled in about 3 to 10% of the patients. Side effects includes the expulsion in about 3 to 10% of the cases. Perforation occurs 1 in 1,000 women. Infection can occur also because of these gadgets. Then is the menorrhagia. But all these things are manageable. The expulsion is common, but the replacement is the solution. And in case of perforation, it's a bit complicated thing, but the person should consult a senior gynecologist for the placement of the copper tea, or the skilled person for the copper tea placement rather than from the untrained personnels. Infection is managed by means of the antibiotics, and the menorrhagia can also be handled by means of the hormonal pills for about 1 to 2 months, and the problem is solved. The failure rate is 0.3 to 1 per 100 women in a year, and for Mirena it is 0.5 to 100 women per year. Fertility restores as soon as it is removed. Now the hormonal contraceptive device that can be placed inside the uterus is known as Mirena. It releases the progesterone for 5 years and the failure rate is less than 0.5%. And the composition of the Mirena is 52 milligram levonorgestrel and releases levonorgestrel 20 microgram per day. Contraceptive benefits of the Mirena includes less infection risk in comparison to the copper T and decreases the menstrual blood loss, and efficacy is 99%. Non-contraceptive method include the non-contraceptive benefit of the Mirena is less dysmenorrhea, less PID, can be used in the menorrhagia or the DUB and decreases the pain in the endometriosis. And it also reduces the size of the fibroids, the patients with the multiple fibroids. Now the second group or the third group including in the spacing method is the hormonal method. Hormonal method that is for the intrauterine device is explained earlier. Hormonal methods include the oral pills, combined oral contraceptive pills, progesterone only contraception. Combined pills includes the oral contraceptive pills, combined injections, dermal patches and the vaginal rings. Progestogen only contraception includes progestogen only pills, injectable progestogen, progestogen only implants, and the hormone releasing IUDs, for example the Mirena. Combined oral contraceptive pills are available in the form of ethinyl estradiol plus the combination of first generation, second generation and the third generation progestogens. Injections are available, that is the Lunel monthly injection that contains 5 mg estradiol cyponate plus 25 mg medroxyprogesterone acetate, and the rapid return of the fertility within about 2 months. Better control of the cycles is achieved by this. Now the progestogens are available in the form of progesterone only pills, injections, implants and the hormone releasing IUDs. Hormone releasing IUD I have already told you that is available with the name of Mirena. Now the oral tablets are also available. Injections are available like Depo-Provera medroxyprogesterone acetate 150 mg intramuscular 12 weekly. 12 weekly means after every 3 months you have to inject the patient with the Depo-Provera for the contraceptive purpose. Progestogen only implant subdermally or the inner aspect of the arm. They are available with the name of Norplant. These are the 6 rods that contain 216 mg of the levonorgestrel, and it releases 80 microgram per day for the first 8 weeks, then 50 microgram per day at the end of first year, and 25 microgram per day next 5 years. This is the picture that is showing the Norplant. These are the 6 rods, and Implanon, the name of these Norplants are available with the name of Implanon, single rod, and contain 3 keto desogestrel, and the progesterone that is released from these Norplants is 25 microgram per day. Now the natural family planning method. Calendar method calculate the fertile days. The maximum fertile days are from the 12th day of the cycle till the 22nd day of the cycle. The mucus or the billing method, that is changing the quality and the quantity of the cervical mucus. Basal body temperature 0.5 degrees centigrade rise in the luteal phase but does not tell the end of the fertile period. And Persona, the fertility monitor dipstick, which measure the urinary LH and the estrogen. And the lactational amenorrhea provide the protection for the 6 months provided mother has solely breastfeed and is amenorrheic. Then is the emergency contraception. Emergency contraception is very important. The patients should know that if they have unprotected intercourse, they can take the emergency contraceptive pills within 72 hours of the unprotected intercourse, and ask about the short or the long-term contraception as well. And these pills are effective in the couples or in the females who have the regular menstrual cycle. If the cycle is disturbed, that the failure chances of these emergency contraceptives is very high. These are available with the name of ECPs in the market in Pakistan. The USP method is levonorgestrel 2 and the levonorgestrel 0.75 milligram, 2 doses 12 hours apart. It delays the ovulation and the failure rate is high. IUD insertion can be done within the 5 days of ovulation, which might be longer than 5 days of the intercourse. Surgical family planning methods are known as the sterilization. In males, the sterilization method is known as the vasectomy, that is the cutting of the vas deferens. And the female sterilization method is the tubal ligation, that can be done via the mini laparotomy, laparoscopically, or issue, or that is the hysteroscopically, the tubal ligation can be done. This is the diagram that is showing the issue, and this device is placed bilaterally within the tubes, fallopian tubes, via the hysteroscope and block the tubes. It creates the inflammatory reaction and the fibrosis over there, and the tubes are blocked. Female sterilizations, these are the ligation by the absorbable or the non-absorbable switches, the ends left free. And these female sterilization can be done during the cesarean section in the patients with the previous 2 or previous 3 or previous 4 cesarean section. At the time of cesarean section, bilateral tubal ligation can be done or via the mini laparotomy. Or these can be done by means of the laparoscopically. Electrocautery can be used, and the Fallop rings are available. These are the rings that are placed over the loop of the tube with a specially designed applicator, and this destroys about 2 to 3 centimeters of the tubes. And the clips are also available. Vasectomy is the division or the occlusion of the vas deferens and prevent the passage of the sperms. The methods includes the clips, diathermy, and the percutaneous injection of the sclerosing agent or the occlusive substances. The success of the procedure is verified by the absence of sperms from the 2 consecutive samples of the ejaculate collected at least 4 weeks apart. Contraception must be continued until the confirmation of 2 negative semen results has been achieved, and this is achieved after 16 to 18 weeks of performing the vasectomy. This is the diagram that is showing the various clips that are available and the Fallop ring. The Fallop ring is placed over the fallopian tube and the tube is blocked. Thank you so much for the patience listening. If there is any question, please email me on my email ID, or you can WhatsApp me the question. Thank you.